Assalamu alaikum. I'm Professor Dr. Hayder Mubarak. This is a presentation to practical aspects of topography of the cerebral hemisphere. This figure shows parts of the brain, which are the cerebrum, the cerebellum, and the brainstem. These parts of the brain plus the spinal cord forming the central nervous system. Of course, the cerebrum is made of two hemispheres, right and left hemisphere. The cerebellum is also made of two hemispheres, and the brainstem is formed of midbrain, bone, and medulla. So we will start with description of topographic anatomy of the cerebral hemisphere. If you will take a coronal section in the cerebral hemisphere, just it is demonstrated here in this figure. This is a coronal section in the cerebral hemisphere, dividing it into anterior and posterior parts. The coronal section demonstrated that the right and left cerebral hemispheres are connected in the midline partially by many structures that will be studied later on. Also, the coronal section shows that each of the cerebral hemispheres has three surfaces. This is the medial surface. Of course, this is the medial surface of the opposite hemisphere. This is the inferior surface, and this is the inferior surface of the opposite hemisphere. Between the medial surface and the inferior surface is a large superolateral surface. So the three surfaces are medial, inferior, and superolateral surface. You can see that the right and left medial surfaces are divided by longitudinal fissure between the two hemispheres, the right and left hemisphere. These three surfaces, the medial, inferior, and superolateral, are divided by three borders. This border is superomedial border, while this border is inferiomedial border, and this border is inferolateral border. Also, you can see that the coronal section of the cerebral hemisphere shows that the outer tissue of the cerebral hemisphere is a gray matter, which is formed of nerve cells that are arranged in 6 layers and is called cerebral cortex. Of course, the 6 layers will be studied in details in histology. And you can see that this the cortex of the cerebrum is folded, showing many folds. These folds are called gyri, and in between the gyri, the folds, are grooves that are called sulci. And the sulci, some of them are shallow, the other are deep, as you can see. To the inside of the cortex, the gray matter of the cortex, to the inside of it, is a white matter of the cerebrum that contains myelinated nerves. And the white matter of cerebrum contains masses of gray matter that will be studied later on. So when we want to start with topographic anatomy of the cerebral hemisphere, usually we start with description of the superolateral surface. This is the superolateral surface. This figure shows the superolateral surface of each right and left cerebral hemispheres is divided into 4 lobes: frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Of course, the frontal, parietal, occipital are enumerated from anterior to posterior, and the temporal lobe is below them. And on this surface, the superolateral surface, there are many landmarks that could be used to demarcate boundaries between these 4 lobes. If we use this figure, diagrammatic figure of superior lateral surface of cerebral hemisphere, we can discuss or we can describe the markers, the landmarks that divide the superior lateral surface into 4 lobes. These are the following. The superior lateral surface of each cerebral hemisphere shows a posterior pole called occipital pole because it lies near the occipit bone of the skull. Also, this surface, superior lateral surface of the cerebral hemisphere, shows an anterior pole called the frontal pole because it lies near the frontal bone of the skull. And also anteriorly we have a temporal pole that also lies near the temporal bone of the skull. Between the frontal pole and temporal pole there is a sulcus, which is this one, called stem of lateral sulcus between the temporal and the frontal pole. This stem of lateral sulcus continues posteriorly and upward, forming the posterior ramus of lateral sulcus. You can see that the posterior ramus of lateral sulcus extends backward and upward from the stem. And you can see that the posterior end of the posterior ramus of lateral sulcus is upturned. This posterior ramus of lateral sulcus used is one of the markers for demarcating the lobes of the cerebrum on the superior lateral surface. The other sulcus is the central sulcus. The central sulcus begins at the superior medial border, behind the midpoint between the frontal pole and the occipital pole. If this is the midpoint between the frontal pole and the occipital pole, behind it on the superior medial border is the beginning of the central sulcus. And the central sulcus descends downward and forward, but not reaching the posterior ramus of lateral sulcus. It stops before reaching the posterior ramus of lateral sulcus. So the central sulcus and posterior ramus of lateral sulcus are 2 sulci that are used to demarcate lobes of the cerebral hemispheres on superior lateral surface. With these 2 sulci, we have 2 imaginary lines. This is the first imaginary line, and this is the second imaginary line. The first imaginary line is said to extend from the parieto-occipital sulcus to the pre-occipital notch. This is the first imaginary line. Parieto-occipital sulcus is a short sulcus seen or beginning at the superior medial border, short distance anterior to the occipital pole, while the pre-occipital notch is a notch on the inferior lateral border, short distance anterior to the occipital pole. And the first imaginary line is in between the parieto-occipital sulcus and the pre-occipital notch. The second imaginary line is the line extending on the direction of the posterior ramus of lateral sulcus, which is backward and upward. It extends with that direction till meeting the first imaginary line. You know, the posterior end of posterior ramus of lateral sulcus is upturned, and if we draw an imaginary line from the posterior end of posterior ramus of lateral sulcus in the same backward and upward direction of its pathway, it will be the second imaginary line meeting the first imaginary line. So 2 imaginary lines and 2 sulci are used to demarcate 4 lobes on the cerebral hemisphere. Before passing into details of gyri and sulci of each lobe of the cerebral hemisphere on the superior lateral surface, we have to say that the posterior ramus of lateral sulcus is the deepest sulcus. You can see this is the posterior ramus of lateral sulcus in coronal section. It is the deepest sulcus. Also here, this is the deepest sulcus, which is posterior ramus of lateral sulcus. Within the depth of the posterior ramus of lateral sulcus is a vertical cortex of cerebrum called insula. Also here, if you pass into the depth of posterior ramus of lateral sulcus, you will be faced by a vertical cortex called insula. And this figure shows you show also that if we are retracting the posterior ramus of lateral sulcus, we will demonstrate in the depth the gyri and sulci of the insula that will be studied later on. And in order to demarcate also, we can see that in this figure, this is the central sulcus. Well, this is the stem of lateral sulcus. This is the posterior ramus of lateral sulcus that is directed backward and upward, but its posterior end is upturned. This is the first imaginary line between parieto-occipital sulcus and the preoccipital notch, and this is the second imaginary line in continuity with the backward, upward direction of the posterior ramus of lateral sulcus. So now we will have to describe in details gyri and sulci in each lobe, the frontal lobe, parietal, temporal, and occipital lobe. This figure shows you that this is the central sulcus, and this is the posterior ramus of lateral sulcus that is upturned posteriorly. So anterior to the central sulcus, this is the frontal lobe. The frontal lobe is bounded posteriorly by the central sulcus, inferiorly by the posterior ramus of lateral sulcus, and then the inferior-lateral border, frontal lobe, superior-medial border. What are the sulci and gyri in the frontal lobe? Anterior to the central sulcus is a precentral gyrus. This precentral gyrus is limited anteriorly by precentral sulcus. The precentral sulcus is directed downward and forward parallel to the central sulcus. Anterior to the precentral sulcus, the frontal lobe shows two horizontal sulci, superior frontal horizontal sulcus and inferior frontal sulcus. The superior frontal sulcus and inferior frontal sulcus divide this region of the frontal lobe anterior to the precentral sulcus into three gyri: superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. So if you want to enumerate gyri of the frontal lobe, you will say precentral gyrus, superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. And if you want to enumerate sulci in the frontal lobe, you will say precentral sulcus, superior frontal sulcus, and inferior frontal sulcus. In addition to that, you can see that the inferior frontal sulcus, gyrus, the inferior frontal gyrus, is divided into three pars orbitalis, pars triangularis, and pars opercularis. What is the sulci that divides the inferior frontal gyri into three parts? If you look to this is the stem of lateral sulcus between temporal pole and the frontal pole. This is the stem of lateral sulcus. You can see that the stem of lateral sulcus gives three rami. One of them, you know it, this is the posterior ramus of lateral sulcus. But this is the anterior ascending ramus, and this is the anterior horizontal ramus. So the stem of lateral sulcus divided here into posterior ramus, anterior ascending ramus, and anterior horizontal ramus. And these three rami divides the inferior frontal gyrus into three opercula, or three pars: the pars orbitalis, pars triangularis, and pars opercularis. Pars orbitalis is called orbitalis because it ovalizes the orbit. Pars triangularis is triangular in shape. Pars opercularis because it covers the insula. If you remove the pars opercularis, you will get the insula, which is this one. This is all about the frontal lobe. Now we will talk about the temporal lobe. Of course, boundaries of the temporal lobe include above the posterior ramus of lateral sulcus and the second imaginary line. Below is the inferior lateral border. Anteriorly is the temporal pole, and posteriorly is the lower half of the first imaginary line. You can see that the temporal lobe is divided by two horizontal sulci, superior temporal sulcus and inferior temporal sulcus, into three gyri, superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. And that's all. And now we will describe the parietal lobe. Of course, the parietal lobe is bounded anteriorly by the central sulcus, inferiorly by the posterior ramus of lateral sulcus and the second imaginary line. Posteriorly, the parietal lobe is bounded by the upper part of the first imaginary line, and superiorly by the superomedial border. What are the gyri and sulci in the parietal lobe? Behind the central sulcus is the postcentral gyrus. This postcentral gyrus is limited posteriorly by a postcentral sulcus that runs downward and forward parallel to the central sulcus. The region behind the postcentral sulcus is divided by a single horizontal sulcus called intraparietal sulcus. This intraparietal sulcus divides the parietal lobe behind the postcentral gyrus into two lobules. Above it, above the intraparietal sulcus, is superior parietal lobule, and below it is the inferior parietal lobule. You can see that the upturned posterior end of posterior ramus of lateral sulcus is arched by the inferior parietal lobule. And similarly, the posterior end of superior temporal sulcus is also upturned and is arched by the inferior parietal lobule. The arch of the inferior parietal lobule covering the upturned posterior ramus of lateral sulcus is called supramarginal gyrus, while the arch covering the upturned posterior end of superior temporal sulcus is called angular gyrus. Regarding gyri and sulci of the occipital lobe on this surface, really there are small sulci and gyri in the occipital lobe, but they don't have a clinical application or significance. So we will not describe them, because every other sulci and gyri that we have just described on the superior lateral surface in regard to the frontal lobe, temporal lobe, parietal lobe have a clinical significance, but all the occipital lobe serving a visual function, and it does not have a clinical function. As you can see in this figure, the description that I had just made on the diagram is not typically seen on the real brain. So let us practice that, putting the system that we are using with a little bit of imagination. So I will revise here. This is the frontal pole, this is the temporal pole, this is the occipital pole. And so this is the inferior lateral border, this is the superior medial border, and this is the superior lateral surface. You can see that this is the central sulcus. It begins behind the midpoint between the frontal and occipital pole, but not reaching the posterior ramus of lateral sulcus. And between the frontal pole and temporal pole, this is the stem of lateral sulcus, and this is the posterior ramus of lateral sulcus that upturned. And also there is an anterior ascending ramus and anterior horizontal ramus. Anterior to the central sulcus, this is a precentral gyrus, and then a precentral sulcus. You can see that there is no single line for the precentral sulcus. It is an interrupted line. Anterior to the precentral sulcus, this is superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. And you can see that the inferior frontal gyrus is divided into pars opercularis, pars triangularis, and pars orbitalis. You have to have a system with a little bit of imagination to demarcate these parts. Also, this is the central sulcus, so behind it, this is the postcentral gyrus that is limited posteriorly by the postcentral sulcus. And this is the intraparietal sulcus, dividing the parietal lobe into superior parietal lobule and inferior parietal lobule. This is the supramarginal gyrus above the upturned posterior ramus of lateral sulcus, while this is the angular gyrus. The temporal lobe shows superior temporal sulcus and inferior temporal sulcus, although it is interrupted. These two sulci form superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. Of course, this is cerebellum, and this is the brainstem, formed of midbrain, pons, and medulla. So that's all about the superior lateral surface. And now we will pass to gyri and sulci of the medial surface of cerebral hemisphere. I just want you to show, I want to show you this figure. This is, of course, I'm choosing non-typical configuration to make you understand that there is no typical arrangement for the gyri and sulci. This is a frontal pole, temporal pole, occipital pole. This is the central sulcus. This is a precentral gyrus, postcentral gyrus, postcentral sulcus, precentral sulcus, superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus. This is the stem of lateral sulcus with posterior ramus, anterior ascending, and anterior horizontal. So this is pars opercularis, pars triangularis, and pars orbitalis. Behind the central gyrus, central sulcus is postcentral gyrus, as in this is postcentral sulcus. So this is the interparietal sulcus with superior parietal lobule and inferior parietal lobule. And this is supramarginal gyrus, and this is the angular gyrus. So there is always a little bit of imagination when you describe the gyri and sulci. This is the preoccipital notch, anterior to the occipital pole by a short distance on the inferior lateral border. And this is the parieto-occipital sulcus, and you can draw a first imaginary line here. So now we will pass to the medial surface, the gyri and sulci on the medial surface. Of course, you can see this is also a medial surface, and this is the cerebellum. This is the brainstem with midbrain, pons, medulla. In the center, or in the lower part of the medial surface, is a comma-shaped body called corpus callosum that represents the lower limit of the medial surface of cerebral hemisphere. And I will show you this corpus callosum in coronal section also. This is the medial surface. It is limited below by this corpus callosum. You can see that the corpus callosum is formed by nerve fibers connecting the right and left hemispheres. It forms the lower boundary of the medial surface. So here is the comma shape of corpus callosum seen on the medial side. The corpus callosum, which is connecting the right nerve fiber connecting the right and left hemisphere, therefore is called commissural fiber, is formed of a large body that ends posteriorly by an enlargement which is called splenium of corpus callosum, and end anteriorly by an angle which is called genu of corpus callosum. So corpus callosum is formed of a large body ending posteriorly by splenium and anteriorly by the genu, by the angle. Beyond the genu, the corpus callosum is tapered to form rostrum of corpus callosum. Therefore, it is said that the corpus callosum is a commissural fiber connecting the right nerve fiber, connecting the right and left cerebral hemispheres, is formed of parts which are as following from posterior to interior. Posteriorly is the splenium, a large body. Anteriorly is the genu, and below the genu, the taper part of the corpus callosum is the rostrum of corpus callosum. Above the corpus callosum, there is a sulcus which is called callosal sulcus, just above the corpus callosum. And above the callosal sulcus is a gyrus which is called cingulate gyrus. Cingulate gyrus. This cingulate gyrus is limited above by the cingulate sulcus. And above the cingulate sulcus, this is the medial frontal gyrus. Of course, you can see here that the cingulate gyrus and the medial frontal gyrus are part of the gyri of the frontal lobe. So if you want to enumerate gyri of the frontal lobe on the lateral surface, there will be precentral gyrus, superior, middle, and inferior frontal gyrus. But you have to add to them if you want to enumerate gyri on the medial surface of the frontal lobe. You will say cingulate gyrus and medial frontal gyrus. You can see that the cingulate sulcus above the cingulate gyrus posteriorly is upturned also till reaching the superomedial border, and anterior to the upturn of the posterior end of the central of the cingulate sulcus, this is the cingulate sulcus, posteriorly it is upturned till reaching the superomedial border. This anterior to this upturn, this is a lobe which is called paracentral lobule. It is a U-shaped lobule that is divided by the central sulcus. The same central sulcus that is seen in the superolateral surface. This central sulcus extends on the medial surface for a short distance anterior to the cingulate gyrus, anterior to the upturned posterior end of the cingulate sulcus, So you can see that the cingulate sulcus posteriorly is upturned, and anterior to this upturn is a U-shaped paracentral lobule that encloses the medial part of the central sulcus, or medial extension of the central sulcus on the medial surface. Behind this paracentral lobule, or we can say behind the upturned posterior end of cingulate sulcus, is a quadrilateral region called precuneus. And behind this quadrilateral region, the precuneus, is a triangular region which is called the cuneus. The quadrilateral precuneus is separated from the cingulate gyrus by a small sulcus above the splenium of corpus callosum. This small sulcus is called suprasplenial sulcus. Below the suprasplenial sulcus, this is cingulate gyrus, while above it is the precuneus. You can see that behind this quadrilateral precuneus is a triangular cuneus. The cuneus is limited anteriorly by the parieto-occipital sulcus, the same of the parieto-occipital sulcus that is seen for a short distance on the superolateral surface and was used to demarcate the lobes behind it, occipital lobe, anterior to it, parietal lobe. We saw the parieto-occipital sulcus for a small part of it on the superior lateral surface, but here we are seeing the longest part of the parieto-occipital sulcus. And also the cuneus, the triangular cuneus, is limited inferiorly by the calcarine sulcus. So the triangular cuneus is limited anteriorly by the parieto-occipital sulcus, inferiorly by the calcarine sulcus. And you can see that the calcareous sulcus, after meeting the parieto-occipital sulcus, it extends, the calcareous sulcus extends for a short distance below the splenium of corpus callosum. And the gyrus between the splenium of corpus callosum and the anterior extension of the calcareous sulcus, this gyrus, is called isthmus. So the calcareous sulcus limits the cuneus inferiorly, and it's directed forward till meeting the parieto-occipital sulcus, and after that extends for a short distance below the splenium of corpus callosum. In between the anterior extension of the calcareous sulcus and the splenium of corpus callosum is a part which is called isthmus. You can see that the precuneus and the posterior part of paracentral lobule, this is the paracentral lobule, the precuneus and the posterior part of paracentral lobule and posterior part of the cingulate gyrus are part of the parietal lobe. Most of the cingulate gyrus is of the frontal lobe, but posterior part of the cingulate, posterior part of the paracentral lobule, and big precuneus are parts of the parietal lobe. Calcareous sulcus is only part of the occipital lobe. Below the corpus callosum, although the structures below the corpus callosum are not related to topography of the cerebral hemisphere, but should be described here. Below the body of the corpus callosum is a lamina which is called septum pellucidum. This septum pellucidum, deep to it is the cavity of the cerebrum, which is called lateral ventricle. And as you can see in this figure, this is the corpus callosum, splenium, body, genu, and rostrum. Here the septum pellucidum is ruptured. It is a very thin lamina. And because it is ruptured, deep to it you can see the cavity of the lateral ventricle, which is the cavity of the cerebral hemisphere. This septum pellucidum extends between the corpus callosum above and a bundle, which is bundle of nerve fiber called fornix. The septum pellucidum extends between the corpus callosum above and anteriorly, and a bundle of nerve fiber inferiorly called fornix. Below the fornix, this is the third ventricle, and actually it is much clearer here. This is the fornix. The septum pellucidum above the fornix is ruptured, and below the fornix, this is the third ventricle. The third ventricle, its wall is formed by the thalamus, and below the thalamus is the hypothalamus. And these, of course, parts of the third ventricle that will be discussed later on with ventricles of the brain. But it is only a revision for it. So below the fornix is the third ventricle. Its wall formed by the thalamus above, and below it is the hypothalamus. Also, you can see that the fornix ends anteriorly into a bundle of nerve which is called anterior commissure. Its name commissure because it connects the right and left cerebral hemisphere, just like the bundle of nerve forming the corpus callosum, also connecting the right and left cerebral hemisphere. So corpus callosum is a commissure. Here is another commissure, which is called anterior commissure, lie at the anterior end of corpus callosum, of the fornix. Also, you can see that the anterior commissure is at the lower end of the rostrum of corpus callosum. We said that corpus callosum is formed by splenium posteriorly, large body, genu anteriorly, and the genu is tapered by rostrum. The rostrum and anteriorly at the anterior commissure, which is also at the anterior end of the fornix. Below the anterior commissure, this lamina is called lamina terminalis. Here also, this is the anterior commissure, and this is the lamina terminalis ending into the optic chiasma, and this is the position of the pituitary gland, the hypophysis. So thalamus, hypothalamus, pituitary position, optic chiasma, lamina terminalis, anterior commissure, fornix, rostrum, genu, body, splenium. This part will be revised later on with ventricles of the brain. We are talking about the lateral ventricle of the cerebrum, third ventricle of the thalamus and diencephalon. You can see that the third ventricle is connected with the lateral ventricle by this foramen called interventricular foramen of Monro between the lateral ventricle and the third ventricle. It lies behind the anterior end of the fornix, or we can say it's behind the anterior commissure connecting the lateral ventricle and third ventricle, and therefore it is called interventricular foramen of Monro. This is all about the medial surface. We have to add that below the calcarine sulcus is a lingual gyrus that is sometimes considered as a part of the inferior surface that we will study soon, and some authors consider it as a part of the medial surface. So now we have to pass to gyri and sulci on the inferior surface, which is the last surface. Before passing into details of gyri and sulci of the inferior surface of the cerebral hemisphere, I want to describe some features related to the brainstem and cerebellum, although there will be another practical session for the brainstem, but I want you to revise these on this figure. It is said that this is the third ventricle. Its wall is formed by the thalamus above and hypothalamus below. And we said that the third ventricle communicates with the lateral ventricle via interventricular foramen. Here we want to add something, that the third ventricle inferiorly continues with the aqueduct, which is a duct in the midbrain. This is the midbrain, and this is a canal in the midbrain, which is called aqueduct. And the third ventricle continues inferiorly with the aqueduct that extend inferiorly to continue with the fourth ventricle of the brain that lies between the pons, medulla anteriorly and the cerebellum posteriorly. Also, we may see that posteriorly the third ventricle is related to the pineal gland. This is the pineal gland below the splenium of corpus callosum. And from that we can go to details of gyri and sulci on the inferior surface. Of course, this is a view to half, one of the hemispheres, not the bilateral hemispheres. You can see that this inferior aspect is bounded by the inferior lateral border from that side and from the inferior medial border from that side. You can see that this inferior surface has two parts. The most anterior part is called inferior orbital surface, while the posterior part is called inferior tentorial surface. The reason is that this inferior orbital surface lies on the orbit that contains the eyeball, so it is called inferior orbital surface. While this part of the inferior surface, the tentorial part of inferior surface, lies on the fold of the meninges, which is called tentorium cerebelli, separating the cerebrum from the cerebellum. Between the orbital inferior surface and the inferior tentorial surface and inferior orbital surface is the stem of lateral sulcus. This is the stem of lateral sulcus. Usually the inferior surface shows a section also in the midbrain that is connected to the cerebral hemisphere. And these are the crura of midbrain. This is the aqueduct of midbrain. You can see that anterior to the midbrain there is a diamond-shaped fossa, which is or region called interpeduncular region or interpeduncular fossa. This region, the interpeduncular region anterior to the midbrain, is bounded anteriorly by the optic chiasma. We have optic nerves uniting to form optic chiasma. The optic chiasma divide to form optic tract. So the interpeduncular fossa or region is bounded posteriorly by the midbrain, by the crura of midbrain, and the interpeduncular fossa is bounded anteriorly by the optic chiasma and optic tract. You can see that this interpeduncular fossa contains the following structures from posterior to anterior. The first thing is a region which is just anterior to the midbrain and between the crura of midbrain is perforated by a blood vessel and so it is called posterior perforated substance. This is the first region and the interpeduncular fossa just anterior to the midbrain and between the crura of midbrain. More anterior to the posterior perforated substance are two spherical structures that are called mammillary bodies. They are parts of the hypothalamus. And more anterior to the mammillary body, the interpeduncular fossa contains an elevation which is called the tuber cinereum that is connected with the stalk of pituitary gland. You can see that lateral to the optic tract, this is optic nerve, these are optic nerves connected by optic chiasma. The optic chiasma divides into optic tract. Of course, medial to the optic tract is the interpeduncular fossa, but lateral to the optic tract, this is the anterior perforated substance, which is similar to the posterior perforated substance, shows perforations by many blood vessels. You can see that this posterior perforated substance, anterior perforated substance, lie lateral to the optic tract but medial to stria of olfactory tract. Here we have medial stria and lateral stria of olfactory tract, and they are bounding the anterior perforated substance. So now we will describe features or sulci and gyri in the inferior orbital surface. Just lateral to the medial, to the inferior-medial border. Of course, this inferior-medial border is called orbital border sometimes. Just lateral to it is a sulcus on the inferior orbital surface, which is called olfactory sulcus because it contains the olfactory bulb and olfactory tract. Here the olfactory tract divides into medial stria and lateral stria that surrounds the anterior perforated substance lying lateral to the optic tract. So the first sulcus is the olfactory sulcus lying just lateral to the medial, to the inferior-medial border, which is called medial orbital border. The gyrus between the olfactory sulcus and the medial orbital border is called Gyrus Rectus. This is the Gyrus Rectus. The region lateral to the olfactory sulcus shows H-shaped orbital sulcus that divides this region into 4 orbital gyri: anterior, posterior, medial, and lateral orbital gyri. So the inferior orbital surface shows olfactory sulcus containing olfactory bulb and the tract, and also H-shaped orbital sulcus. And also this inferior orbital surface contains Gyrus Rectus, which is between the inferior-medial border, that is called medial orbital border, and the olfactory sulcus. And there are 4 orbital gyri around the H-shaped orbital sulcus: anterior, posterior, medial, and lateral. Features of the inferior tentorial surface are the following. This inferior tentorial surface shows 2 longitudinal sulci. The medial one is called collateral sulcus, which is this one. The lateral one is called occipitotemporal. The lateral one is called occipitotemporal sulcus, while the medial one is called collateral sulcus. These two sulci divide the inferior tentorial surface into three gyri, starting from lateral to medial. These are the lateral occipitotemporal gyrus, medial occipitotemporal gyrus, and the parahippocampal gyrus. So the parahippocampal gyrus is between the collateral sulcus and the inferior-medial border, while the medial occipitotemporal gyrus is between the collateral sulcus and occipitotemporal sulcus, while the lateral occipitotemporal gyrus is between the occipitotemporal sulcus and the inferior-lateral border. You can see that the parahippocampal gyrus anteriorly is hooked. It forms a hook. This hook of the anterior end of the parahippocampal gyrus is called ancus, and it is separated from the temporal pole by a small sulcus that is called rhinal sulcus. And you can see that the parahippocampal gyrus continues posteriorly with the isthmus, which is behind the cingulate gyrus between the calcarine sulcus and the splenium of corpus callosum. We had described this isthmus in the medial surface. And also the parahippocampal gyrus is continuous with the lingual gyrus that is below the calcarine sulcus. We said that the lingual gyrus mostly described in the text that it is located on the inferior surface as a backward continuation of parahippocampal gyrus. However, some texts reported that the lingual gyrus is part of the medial surface as it lies below the calcarine sulcus, but mostly it is considered the lingual gyrus is on the inferior surface as a posterior continuation of parahippocampal. So we can say that posteriorly the parahippocampal gyrus divides into lingual gyrus and isthmus. And of course you can see from the color that the inferior orbital surface is part of the frontal lobe. So if you want to enumerate gyri and sulci of the frontal lobe on the inferior surface, you should mention these. And also this is part of the temporal lobe, gyri and sulci, and this is part of the occipital lobe. Never forget when a question comes to ask you about enumeration of gyri and sulci in the frontal lobe, for example, you have to say gyri and sulci of the frontal lobe on the lateral surface, superior lateral surface, gyri and sulci of the frontal lobe on the inferior surface, and gyri and sulci on the medial surface. And the same if you ask about enumeration of gyri and sulci of temporal lobe. Never forget to enumerate gyri and sulci of the temporal lobe from the inferior surface, from the lateral surface, and from the medial surface, and so on. This is another figure for the whole brain looked from below. This is the midbrain, crura of midbrain. This is the posterior perforated substance, two mammillary bodies, then tuber cinereum and infundibulum of pituitary, and this is the optic chiasma, optic nerve, optic tract. This is the anterior perforated substance. You can see that this is the medial orbital border, and this is the Gyrus Rectus. More laterally is the olfactory sulcus containing the olfactory bulb. The bulb is the anterior, followed posteriorly by the olfactory tract. You can see how the olfactory tract divides into lateral stria and medial stria, and the medial and lateral stria surrounds the anterior perforated substance that lie lateral to the optic tract. This is the parahippocampal gyrus, which hooked anteriorly, forming the incus, and this is the rhinal sulcus. You can see the occipitotemporal gyri. This is the lateral occipitotemporal gyrus, medial occipitotemporal gyrus, and you can see also the parahippocampal gyrus, collateral sulcus. Here also you can see that you don't have ideal description. You have to be with a little bit of imagination. Notice that this is the midbrain And behind the midbrain, if the whole brain is viewed from inside, not half of the brain, you can see behind the midbrain the splenium of corpus callosum. This is the splenium of corpus callosum. You can see how the parahippocampal gyrus continues with the isthmus of cingulate gyrus and also continues here with the lingual gyrus. The last topic is about the insula. You know the insula lies in the depth of the posterior ramus of lateral sulcus. If you retract the posterior ramus of lateral sulcus, you will be able to see the insula. The insula is surrounded by a circular sulcus, and it shows the insula as being nearly triangular in shape. It is divided by a central sulcus into an anterior region that contains 3 short gyri and a posterior region that contains 2 long gyri. The exposure of the insula by retraction of the posterior ramus of lateral sulcus make you also able to see the upper surface of the temporal lobe. You know, this is the superior temporal gyrus, but we had looked to the superior temporal gyrus from the lateral aspect. Now, when we are retracting the posterior ramus of lateral sulcus, we can see the upper surface of the temporal lobe. And in this region, on the upper surface of the temporal lobe, you can see transverse temporal gyri that are called Hagel's convolutions on the upper surface of the temporal lobe and the depth of the posterior ramus of lateral sulcus. And behind these transverse temporal gyri, which are called Hagel's convolutions, behind them is a region or a gyrus which is called the planum temporale. Planum temporale. Also, you may notice that the lower part of the limen of the insula is nearly triangular. The apex of it is called limen insula, and this part continues with the anterior perforated substance on the inferior surface of the brain. That's all about topographic anatomy of the cerebral hemisphere viewed from all aspects, and the next session will consider functional localization in these gyri and sulci in each of these gyri and sulci. Thank you very much.